Hello, welcome to therapy. This is our third session of the Self-Relief Anxiety course. This time, we will tell you how to consciously relax in stressful situations with the help of proper breathing. You see, breathing is an unconscious process, but with the help of it, you can consciously influence the nervous system. In response to stress, abdominal muscles tense up and press on the diaphragm during inhalation. Due to this fact, the volume of the air inhaled is reduced, and some of the air stays in the upper part of the lungs. And as a result, the person experiences a lack of oxygen, which in turn becomes a signal of distress for the body. Breathing becomes quick and shallow. This is the main sign of panic in progress, but panic is easy to end before it takes over the body and mind. To instruct the nervous system to relax, you just need to breathe with your belly. But do people really know how to breathe with their belly? Someone might say, there are no lungs in the abdomen. Well, of course there aren't. The impression that the abdomen is breathing is created by the fact that it gets bigger and smaller with the movement of the diaphragm. In turn, the diaphragm moves with deep, full breathing. Therefore, the more correct name for the technique belly breathing would be diaphragmatic breathing. And if you have ever done yoga, then you probably know that such breathing is also known as yogic breathing. Look at how children and animals breathe. Notice how actively and naturally their bellies move. You may know that women are also advised to breathe during contractions while giving birth, that is, with the stomach, and with an emphasis on prolonged exhalation. A full deep exhale relaxes the muscles, and active involvement of the diaphragm returns the amount of oxygen to normal. In addition, concentration on breathing itself is calming. Thus, proper breathing helps the body switch from a stress response to a relaxation response, energizing the body and feeling well. Remember that breathing with an active involvement of the diaphragm is not recommended for people with heart and vascular diseases. Therefore, before starting to practice, please consult your doctor. To experience the effectiveness of proper breathing yourself, do these 2 exercises. See you in the next session.